So Harvard Magazine, or Harvard, well, it's actually harvardmagazine.com, but it's a Harvard University Medical School, or the magazine asked several faculty members from the medical school to write about the situation with healthcare in the United States. The United States spends $3.5 trillion a year in healthcare, more than any other country in the world, more than any other developed country in the world, more in absolute numbers, more as a percentage of GDP, more as, in any way you look at it. We have the most expensive, in fact, as much as any other developed country in the world on healthcare. And we have a shorter lifespan as a result of that. You know, basically all we have are, what we get for that are a bunch of hospital and insurance and pharmaceutical executives who have 35-room mansions with, you know, detached servants' quarters. And you know, luxury yachts. I mean, that's literally, you know, Dollar Bill McGuire, the guy who started United Healthcare, walked away with over $1 billion. His successor, Stephen Hemsley, walked away with more than $500 million. It's big money to be made in healthcare in the United States, since the Reagan Revolution basically deregulated healthcare all across the United States. Nearly half of Americans, as a result of this, because we have the most expensive healthcare, and because you know, a mind-boggling percentage of, about 10% of us are uninsured, about half of Americans say they have delayed or skipped medical care because of the cost. We have the lowest life expectancy in the developed world. Underlying all of these problems is the high cost of medical care. 2/3 of Americans want the federal government to regulate the price of medical care. This is from the Harvard magazine. Pharmaceutical companies put profits above patients, and insurance executives are paid millions to deny coverage. The authors at Harvard say the government should stop both. Amen. The largest component of our healthcare spending, medical spending in the United States, is administration. Profits and executives, multi-million-dollar salaries, all that kind of stuff. Germany and Switzerland, their healthcare administration is less than half the cost of the U.S. Also, greed is the second part of excessive health spending. The price for insulin is 10 times higher in the United States than it is in Canada. And they're making money selling insulin in Canada. So it's no mystery, you know, when prices rise, there's nowhere else to go because, you know, of our patent laws and things like that. So we should put into place price regulation. It's just pretty straightforward. We need to get our healthcare industry back from the blood-sucking leeches that have attached themselves to our backs.